Hi, I'm Dr. Tracey Banks, and welcome to Bankable Health Tips. This is a show where we provide you with the latest information on health topics that affect you. Today, we're going to continue our series on contraception and talk about oral contraception, or the pill. So first of all, what is the pill? And how does this tiny little pill prevent me from getting pregnant? Well, the pill basically is a pharmaceutical preparation that contains the hormones progesterone and or estrogen. It is 99% effective when taken perfectly, but it does not protect against sexually transmitted diseases. So how does it work? The pill actually influences your body's own natural hormones so that your ovaries don't produce an egg every month. It also thickens the cervical mucus, or the mucus to the opening of the uterus, that makes it very difficult for the sperm to reach the egg. And finally, it thins out the lining of the uterus so that a fertilized egg won't be able to attach. So the pill has many benefits. It is one of the most studied medications out there because it's been around for over 50 years. Of course, the main benefit of the pill is that it prevents an unintended pregnancy. But its benefits go far beyond contraception. The pill also can make your periods lighter and shorter. It can make your periods less painful. It can regulate your cycle. So if you have irregular periods, it can make your cycles very predictable and give you more of a hormonal balance. It can improve acne, as well as improve symptoms of premenstrual syndrome or premenstrual dysphoric disorder. And finally, the pill actually protects you and decreases your risk of getting ovarian and endometrial cancer. The pill is not without risk, however. The main risk of the pill is that it can increase your risk of blood clots in your legs or lungs. This risk is especially high in women over 35 who smoke. So if you are in this age group, the pill is not right for you. Other risks are increased risk of heart attack and stroke, gallbladder disease, and liver tumors. But these risks are very, very small. And if you have any questions about your specific risks, please contact your primary care provider. Now, there are several different types of pills. There are pills where you can have a period every month, every 3 months, or not at all. Let's talk first about the monthly pill. There are two types of monthly pills. The first one we're going to talk about is the combination pill. And it's called the combination pill because it contains both progesterone and estrogen. This pill is 99% effective when taken perfectly and basically comes in two types of pill packs. One is a 21-day pill pack and the other is a 28-day pill pack. So the combination pills comes in basically two types of pack. The first one is a 21-day pack. With this pill, you take 3 weeks of active pills, and then the last week you don't take any medication. It is during this week when you're off the medication that you will get your period. In the 28-day pill pack, however, you take a pill every day no matter what. The first 21 days are the active pills, and the last 4 to 7 days will be inactive pills. It is during this time that you'll get a period. So even though you're not taking active medication, you're still taking a pill every day. So the next type of combination pills are the quarterly pills. These are the pills where you get a period once every 3 months. And they're also called extended cycle pills. They come in mega pill packs. You'll take one pill every day for 84 days. In the last 4 to 7 days of the pill pack, you may take inactive pills or estrogen-only pills. But it's in this week that you'll get your period. The main advantage of these pills are that you only have a period once every 3 months. But in the first pill pack, as your body adjusts to it, you may have more breakthrough bleeding or bleeding at a time when you wouldn't expect. This usually works itself out as your body adjusts to the pill. The other type of birth control pill is the mini pill or the progesterone-only pill. This pill does not contain any estrogen and is usually reserved for women who are breastfeeding or who can't take estrogen for whatever reason. It's considered not as effective as the combination pill, but it always comes in a 28-day pack and you always take an active pill every day. And lastly, we have the no period pills. These pills always come in 28 pill packs. They are combination pills, which have both estrogen and progesterone, But in these pills, you take an active pill every day. There's never a day when you take an inactive pill, so therefore you don't get your period. Like the extended cycle pills, they tend to have a little breakthrough bleeding in the beginning, but usually your body works itself out as you go along. So we've talked about the risk and the benefits of the pill. What are some of the side effects? Well, the main side effect is breakthrough bleeding, and that's bleeding at a time which you wouldn't normally expect. This can happen particularly when you first start the pill in the first 3 months, but usually works itself out as you move on with the pill. Other side effects are very mild and also usually work themselves out as you adjust the pill, but they include headaches, nausea, and missed periods. Sometimes when you've been on the pill for a while, you may stop having periods even when you're on the monthly pill, and that's okay. Other side effects that are specific to the progesterone-only pill include weight gain, acne, increased emotional changes, and excessive hair growth. This is why we usually reserve this pill for only certain types of women. What are some healthy tips that I want you to keep in mind when looking at the birth control pill? The one is try to remember to take it at the same time every day. What I usually tell my patients is to put your toothbrush right on top of the pill pack. That way, when you brush your teeth every morning, you'll remember to take your pill and you kind of get it incorporated into your routine. Other things are that the side effects usually are temporary. If you experience headache or nausea, try to keep taking the pill because they usually work themselves out within a few weeks. There are certain types of drugs that can affect the pill, such as antibiotics and antivirals. So if you're on an antibiotic, make sure you use a backup method until you're 3 days off the pill. And lastly, if you miss a pill, don't panic. Usually you can just double up the next day, but always read the pill package insert just to be sure. Well, thank you for viewing this segment of Bankable Health Tips. In our next segment, we're going to cover emergency contraception. I'm Dr. Tracey Banks, and remember, be healthy.